Hey everyone. Greetings. Welcome. It's Naomi Wolf of Daily Clout, and I'm so honored. I'm honestly honored beyond measure to be joined today by the amazing Amy Kelly. That is her name now. That's how it's going to be described in the history books. Amy Kelly, of course, is the COO of Daily Clout. She's also project director of the War Room Daily Clout Pfizer Documents Research Analysis team of 3,250 doctors and scientists. She's the person who quite extraordinarily allowed the world to know about the Pfizer documents and what was really in them, because subsequent to their being released by a successful lawsuit by lawyer Aaron Siri, there were hundreds of thousands of documents that would not have been understood, analyzed, brought to the public in understandable form if Amy Kelly had not convened and overseen this monumental project. So welcome, Amy Kelly.
Thank you. I'm glad to be here.
We're so glad to have you. And it's very, very newsworthy what you are sharing with us today. As I understand it, a citizen in Canada, a couple of Canadian citizens FOIA'd the Canadian medical database codes and got some data that you've analyzed with some pretty stunning insights. So first, tell us what got FOIA'd and what was the data set?
Okay, it's actually Ontario instead of all of Canada, just to clarify that. There were 2 FOIAs done, and it was from the Ontario Health Insurance Plan, which for short is referred to as OHIP. And they FOIA'd women and men's reproductive codes from 2015 through 2022. And so from that, you get distinct patient visits during that time frame, as well as a number of incidents during that time frame.
And so how many records? I mean, this would have been, as I understand it, pretty much everyone in Ontario, right? Because there's a socialized medical system in that province and all of Canada. So pretty much everyone is in this database in Ontario. Is that correct?
That's correct. There's about approximately 15 million people in Ontario now. And as the Canadians we worked with on this explained it to me, everyone has to first see their primary care doctor there to get referred to a specialist. Of course, this is for non-emergency situations. Right. And this data we are looking at is outpatient data. So it doesn't include things like emergency situations. And
gotcha.
And I forgot what I was going to tell you about it next when we changed tax, but there's certain codes that they use in the socialized data or socialized medicine system so that when they go to their primary care doctors, the doctor says, okay, these symptoms align most with this code, and then put that in their medical record. And then there's people who are medical coders and billers, and they enter that into the health insurance program. And so that all goes into the OHIP database, and that's where this data came from.
Understood. So it's government data. It's a government database. It's used by the medical system to create codes for different diagnoses. Go ahead, Amy.
I remember the other thing I was going to say. So there are about that many citizens in Ontario. This particular data set, looking at the reproductive codes we're going to be talking about, accounts for about 6 million people. So it's a subset of the overall data.
Okay. So I'm just going to read now from your incredibly important analysis of this data set, which everyone can find on dailyclout.io. And this is the headline: Canadian government database reveals catastrophic reproductive damage to men and women post mRNA vaccine rollout. And I'm just going to lift out the center of your first paragraph. Importantly, this data set contains 4 years of baseline data from before COVID-19 or COVID-19 vaccines appeared in Canada, meaning 2015 to 2019, correct?
That's right.
And thank you. And the COVID vaccine years of 2021 and 2022. This gives us a window into the health changes Ontarians experienced following the introduction of COVID vaccines, of which over 85% of Ontario residents took 2 doses by March 30th, 2022. About 50% of the same group of people received a 3rd booster dose by the same date. So it reflects a highly vaccinated population. And this is your headline. This data set shows clear evidence of an increased number of patients who sought medical care after the public rollout of COVID-19 vaccines in Canada for reproductive disorders. The categories of reproductive disorders that showed increases starting in 2021 range from male infertility, low and no sperm count, to pelvic inflammation, to menstrual disorders and postmenopausal bleeding, to missed and incomplete abortions, or what is commonly known as miscarriages. So that's the headline of what you found. Could you do us a great favor, Amy, and look at your first slide there in your article and just read what are the codes and what do they stand for?
Sure. So code. So it is called a diagnostic code. There's a link to the actual set of codes that you can go to. However, a better way to think of it is really a billing code. They aren't saying with absolute certainty, this is 100% the diagnosis. Again, we go back to, they visit a medical professional, and the medical professional has to decide what it most closely aligns with for billing, and that's how they get to these codes.
So then what are these top 9 that you found that have to do with reproduction? Thank you.
So 606 is male infertility, particularly low sperm and no sperm in semen. And then 614 is acute inflammation of the fallopian tubes, as well as inflammation of the ovaries and pelvic inflammatory disease. 626 is disorders of menstruation. 627 is menopausal and postmenopausal bleeding. 628 is infertility in both men and women. 629 is other disorders of female genital organs. 632 is missed abortion, which again is a type of miscarriage essentially. And 634 is incomplete abortion or complete abortion, again, miscarriage types.
Okay, so the slides show an average of distinct patients. You averaged out the numbers of patients 2015 to 2019, and you compared them with the average of distinct patients for 2021 to 2022. And then you explain your methodology. And then you've got some there explaining the billing and diagnostic codes and what they mean. So let's start with your first slide that shows the actual barcode of the comparison, or not barcode, bar graph, comparing the average of these people who went to see their doctors and got this diagnosis, these codes, from 2015 to 2019 versus 2021 to 2022. And again, that's the COVID vaccine years. Just walk us through male infertility, including low and no sperm counts in semen, oligospermia, and azoospermia, and how the numbers rose. And if for people who would like to see a very dramatic visual representation, there are the bar graphs right there. The lower one is the earlier set, 2015 to 2019, and the higher one is 2021, 2022. That's men complaining of infertility, low or no sperm at all in their semen. So tell us what you see there.
So in the pre-COVID years, the average per year of distinct patients was a little over 24,600. And then in 2021 through 2022, it was almost 32,700 distinct patients. So definitely an increase.
Wow. And then let's go down to the number of patients with female chronic pelvic inflammatory conditions and diseases, and how that category of complaint and diagnosis rose. And again, I'd love for you to read that headline of that chart. And then I'm just going to hold up the bar graphs so people can see them there. Can you walk us through that slide?
Yes, I think I may be able to present my slides if you would like me to try that, but either way.
I think it's safer just because we're live to refer people to dailycloud.io where you can call this up and walk along, and just to avoid losing you, because I'm not that technically expert. Let's just go ahead and do this. It's
inflamed or swollen fallopian tubes and ovaries, as well as pelvic inflammatory disease. And pelvic inflammatory disease comes from a bacterial infection. A lot of times it's associated with sexually transmitted diseases that then cause that, but it doesn't have to be from a sexually transmitted disease. And this is OHIP code 614. When you look at the average per year for 2015 to 2019, it was almost 7,000 people. And then in 2021 to 2022, it was a little over 7,500 people.
Right.
And I had told you previously, one thought I had on this, especially in relation to the pelvic inflammatory disease, and I don't know this is just a thought from all the other work I've done around this, is that COVID vaccines do suppress the immune system and your ability to fight infection. So if a bacteria is introduced that could cause something like pelvic inflammatory disease, then I think people who have been vaccinated, and especially vaccinated and boosted, their bodies would have less ability to fight that off on its own.
Let's talk a little more about that, Amy, if you would. I mean, we're only 2 slides in I think 9 categories. And to me, what's really interesting as someone who's kind of watched the process of you creating these 100 reports now, or probably over 100 reports with your volunteers, is what we're getting is a more detailed picture of inflammation, right? And earlier reports by Dr. Chandler and others have explained a mechanism whereby, and I'm not saying I know this is what's happening, this is the kind of conversation we should all be having, as these points of data emerge. You've got things we haven't even seen before here: inflamed or swollen fallopian tubes and ovaries, pelvic inflammatory disease going up dramatically post vaccination, post boosting this population. And you've got the killing of sperm or low sperm count. And we're going to see other kinds of inflammation. And you make a really good point. I mean, literally, just to kind of detour not very much down a rabbit hole at all, neighbors of ours are, having multiply infected tonsils, right? And they have to get their tonsils removed. They're adults. I just talked to someone on the phone who had a respiratory infection and he can't get over it. He's exhausted. It's a bacterial infection that he can't clear. So all around us, baby just got taken to the hospital for, again, pneumonia that the baby couldn't clear it. Seeing a situation in which, as has been well established, the immune system is shot, and so people are not able to deal with bacteria as well as they used to. So what I said to you is, it's like, well, it's a couple of things that are just hypothetical, right? So one hypothetical that presents itself to me is, and we talked about this a little bit, you and I, and I'd love to know, have feedback from the volunteers, but it's like, we had this kind of golden moment, right? After the pill and, before AIDS, but then even with safe sex, even to this day, in which people could have intercourse, without like a 19th century reality of, oh my God, I'm going to get syphilis, or I'm going to get gonorrhea, or, something will happen. There's something my body won't be able to deal with, right? Like literally short of, I guess, herpes for a lifetime and certainly HIV, most STDs have been dealt with, right? But seeing from this, and it's not even just necessarily STDs, but just bacteria, right? That maybe having intercourse isn't as is a little more dangerous than it used to be. I mean, there's no better way, easier way to put that people's bodies don't have the ability to deal with the various bacteria or, things you come in contact with ordinary sexual intercourse. Do you have thoughts about that? I mean, you brought it up and I thought it was a brilliant point,
Yeah, I mean, I definitely feel like anytime you're having intercourse, well, it's not even potentially, you are introducing bacteria into your body one way or another. And so, if you've had the vaccines and been boosted and even boosted multiple times, it's going to be much more challenging for your body to deal with that in the normal way it has dealt with it before, in my opinion.
Right. And it's so
Mhm.
interesting. I think of you, and you've given me permission to say this publicly, as the woman who saved the penis, because you're the person who broke the story that these mRNA injections were degrading the Sertoli cells and the Leydig cells of baby boys in utero, which turn on masculinity. And you did a report on harms to the penis, in the Pfizer documents. We'll get to horrible genital problems later on in your presentation here, but you're making such a good point, because I think we've kind of accepted that things like cancer, our bodies, if we're post-vaccinated, can't clear the precancerous conditions as well. Things like respiratory disease, which I just mentioned, infections, our bodies can't clear them as well. We all get that, but we really haven't. And in a dream world, it wouldn't be Amy Kelly and Naomi Wolf having this conversation. It would be the New York Times, the Wall Street Journal, right? But your reproductive system is a system, just like your lungs or like your anything else that comes in contact with bacteria or other kind of difficult things that your body can usually get rid of with your immune system. So yeah, I think it's fair to say, those of you, I mean, I always think of like young adults I know and love, and I might feel perfectly comfortable saying to them, party on, use it, go on the pill or whatever, party on, as long as you're not, getting STDs randomly. But now I'd be more inclined with your input here to say, maybe use a condom, or maybe use that maybe some more protection is necessary. Maybe a spermicide, right? Like we don't know what could help the body fight off the vulnerability to bacterial infection that honestly men and women are both subject to, looking at this data, but women are always going to be more subject to it just biologically. The other thing I want to ask you about before we go on to these next slides is there's also a picture of inflammation, right? We talked about inflammation at previous reports that I mentioned, Dr. Chandler's report showing that the lipid nanoparticles go everywhere like a shotgun blast, as he puts it, to the body, causing inflammation. And so many of the reports that you brilliantly brought to the world and the volunteers brought to the world deal with the impacts of this inflammation, whether it's arthritis, rheumatoid arthritis conditions, respiratory conditions, autoimmune disorders. These are inflammatory. But we're going to go through some slides that show inflammatory conditions now in the sexual organs and in the in the reproductive system. I mean, we're looking at inflamed fallopian tubes, inflamed ovaries, and we're going to be looking further down the line at inflamed testes and an inflamed epididymis, even if the signal is not as clear in that slide. So there's inflammation throughout the body. It stands to reason we're seeing like pelvic inflammatory disease, right? So I guess what I would also ask you, and this is very sensitive, but I just can't help thinking about it. That section of the Pfizer documents where they warn vaccinated men not to have intercourse with childbearing age women, and if they do, to use reliable forms of contraception. And both of us have gotten emails after we brought that to the world of desperate women, mostly saying, what is it? What is it that Pfizer knows is in the semen of vaccinated men? Well, something I just want to raise to you, and I know it's just a question, is could whatever's in the semen of vaccinated men be inflammatory?
I mean, we know it's passed through bodily fluids and that it crosses all barriers. So I think, at least in theory, that could be something that could be a contributing factor, especially if you have a vaccinated woman and a vaccinated man coming together.
That seems like the kind of thing a, Johns Hopkins or, the Kaiser system should test like tomorrow. And you and I know that we literally are going to have to ask, the one pathologist or one of a very small number of pathologists we know. I mean, really, we should ask Dr. Ryan Cole to test vaccinated semen. Is there something that could be in vaccinated men's semen that is causing this inflammatory set of conditions? And maybe not, God willing not, but it's just really notable that we're seeing either systemic inflammation throughout the body, which also manifests in reproductive organs, or maybe that and the added factor of maybe something inflammatory in semen, or maybe not, right? We don't know, but we don't know. Do you have any thoughts about
just looking back on that report I did, which was quite a long time ago now, maybe a year and a half, on male fertility in relation to the vaccines, and I pulled all those studies on it. And one thing that was interesting in that was how depressed the sperm levels were in semen even months afterwards. And I think they only went 5 months out. And so, I mean, that's not a terribly long window for that.
right.
But, they had the men testing over and over again during those months. And it definitely affected that aspect of their reproductive systems as well.
That's right. And you're not, I mean, there's another data point to back you up, right? Because Andrology Journal also ran a study out of Israel showing that male sperm counts and sperm motility was negatively affected by the vaccines. So then let me ask you this before we go on to the next slides. And please don't judge me. I know that these are weird questions in a way, but they're also what's weird. Like, we're dealing with the weirdest possible thing. What, one of the conditions that we've just looked at is no sperm at all in the semen, right? None, dead semen, basically. Not just low sperm count, like in the andrology study, not just low motility, like in the andrology study, but they're just all dead. And then I'm thinking, and this is why I keep thinking, is there some change in vaccinated men's semen? Or maybe it's the pH of vaccinated women's, uteruses is also possible. But I guess what I'm trying to say is it would be pretty easy. Like, you and I know one of the freakiest things about the Pfizer documents is that COVID is supposed to be a respiratory disease, but you and I know there was very little about the lungs or mucous membranes and tons about the genitals and the, and menstrual cycles and ovaries and sperm, tons and tons and tons. Super weird, right? Not so weird, because it's not a bug, but it's a feature. But where I'm going with that is, if you wanted to create a depopulating injection, one way I imagine you could do it, and I'm just thinking about the rhythm method now, where you're supposed to check basically the pH, right, of inside of your body.
Right.
Well, if you wanted to kill sperm, you could just change I imagine, I'm not a scientist, change the pH, the alkalinity or the acidity of the sperm, right? If you wanted to create a hostile environment in which it was more difficult for women to conceive, you could change the pH balance, basically make it more acid or more alkaline of the uterine lining or the vaginal canal, right? And maybe none of this is happening, but I keep thinking, and I've written about this, about how people who are vaccinated, their smell is different, or they have no smell, right? And it's my subjective, I'm not imposing this on you or on David Cutt, it's my subjective perception, right? That it's harder to pick up that signature trace of the human scent. Well, that's a chemical change, right? In the makeup of the body, and presumably a chemical change in, again, body fluids, right? Like sweat. And you were referencing a part of Pfizer documents that talks about shedding, right? Do you want to refresh people's memory about how Pfizer defined exposure to the vaccine?
In this particular situation, they clearly stated that you could have sexual exposure to the vaccine. They were very protective over vaccinated men being around women who could get pregnant or women who were pregnant when that situation arose in the clinical trial. They actually even they had this pregnancy category that they even put men into because they had exposed women of childbearing age or pregnant women to that. So it was through bodily fluids essentially, and they also said skin to skin contact.
Wow. All right. So again, bodily fluids includes semen. It also includes vaginal, whatever fluids, and it also includes sweat. And so intimacy is going to be, judging from or extrapolating from the Pfizer documents, intimacy and sexual intimacy could be a context in which something is changed, right? Judging. And again, we're talking so impressionistically because the Pfizer documents are impressionistic, but we're faced with this very stunning, data that show that something's changed in the bodies of Ontarians before and after the injection. All right. So
I wanted to bring up one other thing related to this, just people may not know about it, or to refresh memories. I know you're aware of it. There is also an autoimmune condition that showed up in the post-marketing documentation. The post-marketing documentation was from December 1st, 2020, or I should say the data and documentation, December 1st, 2020 through February 28th, 2021. And I can't for the life of me remember the exact term of the adverse event of special interest, but in what was going on with it, and I wrote about it in that male fertility article, is that the man's body views its own sperm as an external enemy and attacks it and kills all of it. So it's viewed as an infertility issue.
Oh my gosh, which would result in, we don't know yet if that's a cause, but one possible result would be what this code is: no living sperm.
It definitely could fall within that, I would think, because that is the outcome in that particular condition.
Right. Well, very chilling. Let's move on. And this is just so important. You all know that we've been screaming and yelling at Daily Clout about menstrual disorders, since 2021. And again, Dr. Robert Chandler, one of the volunteers working under or with Amy Kelly, revealed that in the Pfizer documents, there were charts of menstrual disorders, like literally, so chilling. One line showed 15,000 women with, bleeding every day of the month. The second line showed 10,000 women with 2 menstrual cycles a month. The third, no more menstrual cycles at all, like on and on and on. Like little girls getting their periods upon being injected, 80-year-old women bleeding. So this is a very important slide. And I want you to walk us through it, please. Code 626, disorders of menstruation. I'll hold it up again so you can all see how striking it is.
So in the pre-COVID years of 2015 through 2019, the average distinct patients per year that were coded with that code was 408,717. And then when you look at the average per year for 2021 and 2022, it jumps up to 418,713 distinct patients on average per year.
Wow. So this is literally at least like 20,000 more women in 2 years reporting menstrual disorders in one province in Ontario, Canada.
About really 10,000, I think. But yes, when you go from...
Oh, I see 408, 418. I beg your pardon. Yeah, exactly. 10,000 more women in just 1 year. So that's going to be 100,000 women in a decade if these trends continue.
Mhm.
That's really shocking. All right,
Yes.
so then let's go on to the next slide. What
Okay.
is the next slide about?
The next
Post-menopause.
one is menopausal really, and postmenopausal bleeding. So women that are in menopause or have already gone through it and afterwards and aren't having periods anymore. And this is something we've heard a lot about since the vaccines rolled out, about, I would say anecdotally, about this occurring, and everyone was, really like, no, it's not happening. That's not what it is. Maybe it's this. But what we see here is that in the pre COVID years, it averaged 171,666 patients. And then once the vaccines rolled out in 2021 through 2022, it averaged 193,871 patients per year.
Unbelievable. And I
Mm-hmm.
just want to chime in and say, I talked to the doctor who FOIA'd, one of the people who FOIA'd these data,
Mm-hmm.
and excuse me, and another Canadian whose group, the Kaleidoscope Strategic Group, did an analysis of these data sets. And what both of them stressed to me, and so scary, is when postmenopausal women have bleeding, the first thing you have to rule out is cancer. Like, it's a very serious symptom. And so now all these thousands of postmenopausal women, I mean, really, that's a more than 20,000 woman jump there in 2021 to 2022 in this one province in Canada. Imagine what it's going to do to those women, 20,000 women in 2 years who are menopausal, they're not bleeding, some of them are in their 70s and 80s from the cases that I've heard about. And they have to go to their doctors and go through the whole terrifying experience of being checked for cancer, and having that out. And the burden also that's going to put on our all of our healthcare systems, as these tens of thousands of menopausal women present with bleeding, and they have to be checked, every single one of them, for cancer, not just the only time it happens, but every time it happens. Do you want to say more about that slide about menopausal and postmenopausal bleeding?
No, I think you covered it well. It's just, what a terrifying thing for a woman to have happen. Especially I've heard directly from women, say in their mid 70s, that this has happened to, and they had no idea what was going on. I mean, you assume nothing but the worst, and it's very frightening for them.
Yeah, of course.
Mhm.
Let me just jump in there and say, I think one of the things that's hardest about these findings, or this journey of, layers of discovery of the damage that's been done reproductively, that you've been so integral in bringing to the world, is the world dismisses menstrual health. And it's, as I often try to communicate, especially to male doctors, but even, women doctors are complicit in sweeping this issue under the rug, not, mocking people who tried to talk about it. It's hard enough to be a childbearing age woman, and it's hard enough, for women to go through every stage of their reproductive lives without having these horrible additional burdens and disorders and dysregulation. I mean, in addition to all we now have tens of thousands of additional older and elderly women in Ontario having to worry about, why am I bleeding? Do I have cancer? Every time we bleed. The chart we looked at with menstrual disorders, those women, every time they don't bleed, they're going to wonder if they're pregnant, and they're a god awful experience of, like, am I pregnant? Am I going to have a baby, that I didn't plan for? What do I do now? Do I mean,
Yes. Do I have cancer?
I have cancer, exactly. Or, I keep trying to describe this as, like, you can only imagine the disabling nature of bleeding every single day, or 2 periods a month. I don't think men can begin to understand that is a disabling condition. right?
Mm-hmm.
And women know that it's disabling, but there's such shame and silence around this
Mm-hmm.
situation. Oh, it's just, and you and I have seen how the medical establishment talks about this. Oh, yes, finally they admitted there's a study that shows that there are changes of just a day, changes. Well, these are
Mm-hmm.
not changes. These are like
Yeah.
horrors. And as I always like to remind everyone, if you've got dysregulated bleeding, you've got dysregulated hormones, right? Which means
Mm-hmm.
dysregulated energy, dysregulated mood, dysregulated concentration, all the things. So no, we don't get
Mm-hmm.
to be just healthy women at whatever stage of our reproductive
Right.
lives with this injection. We are not healthy reproductively with this injection, whether we're, childbearing age and having menstrual problems or
Mm-hmm.
postmenopausal, worrying about bleeding. Is there
Well,
anything you
and
want to
yeah,
please go
there's
ahead?
been a lot over the years. I mean, maybe since the 80s, you might be able to speak to some of this during the 90s when I know you were writing about and so forth. But there have been so many studies done about how many work hours are lost in workplaces because of women and what they're dealing with their menstrual cycles and so forth. And so when you throw a wrench into that and it becomes disordered or somebody has it going on all the time, then there's going to be exponential effects of that because the woman could be, as you just said, physically suffering in so many different ways. And
Mhm.
it could affect her ability to be at work and be effective in the workplace as well, not to mention with her own family.
Well, you literally took the words right out of my mouth, Amy, like
Mhm.
100,000%. And then what about family life? What about
Right.
relationships? What about, you know, sex? What about parenting?
Yeah.
I mean, all the things you need to do as a woman are so much harder to do if you're like literally bleeding all the time, or having unpredictable bleeding or weird bleeding with hemorrhaging, which we've seen in the Pfizer documents, passing tissue, like horrible conditions. And
Mhm.
I can't believe, again, moments like this, I can't believe that you and I and Dr. Thorpe are literally the only people talking about this, so
I
we'll
was
lie
just
credit her,
Yes,
but
I was just thinking about Dr. Thorpe because he did that peer-reviewed paper on the decidual cast issue, and for those of you that don't know what this is, it's associated with the vaccine, and again, in a peer-reviewed paper, it's when a woman sheds the entire lining of her uterus all at once instead of over the course of, say, 5 or 7 or 10 days. It's extremely painful from the people who spoke out about what it's like, and there was a noticeable increase in this occurring after, excuse me, people began getting vaccinated.
how horrible and revolting. Well,
Mhm.
you're explaining, I think, these folkloric situations. There are telegram groups, and I've actually seen some photographs on social media of people saying, like, this emerged from my girlfriend's body, what is it? Or this emerged from my body, what is it? And
Mhm.
it could be uterine, right? I mean, if what you're describing is happening, and we know it is,
Mhm.
it's not unheard of. I mean, this is just such a crime because basically the lipid nanoparticles, they kind of they dissolve people almost, right? And
Mhm.
the uterine lining is where you're most, how can I put this? You're most kind of vulnerable, like the line between you and not you is very fungible, right? Like
Mhm.
your uterine lining every month as a woman. So there's a part of your body that dissolves, right? Like every month if everything's going well. And
Mhm.
that's normal and that's healthy. But what these injections seem to do is literally make humans more destable. Like it
Mhm.
destabilizes the uterus, it destabilizes the placenta, it destabilizes the blood-brain barrier, right? All of these
Mhm.
boundaries in our bodies get compromised, and
Mhm.
it's such a crime. So let's go on now to
Mhm.
infertility. Not surprisingly, there's a slide on infertility. If you'll just walk us through that
Yes.
slide.
This is male and female infertility. So it was just over 94,000 distinct patients per year on average from 2015 to 2019. And then in 2021 to 2022, it jumped to 112,450 patients on average per year.
Oh my gosh, that's another significant signal, isn't it? I'm going to read those numbers again, if you don't mind, for everyone to process that. Before the COVID year, it was 94,039 on average. And in the vaccine years, 2021 to 2022, 112,450 on average. So that's, imagine the number of families, the number of couples trying to get pregnant who can't get pregnant and see their doctors in one Canadian province. Very dramatic signal there.
Well, and I think this slide it's a great place for this slide to be in here, because it's not unexpected to see this after seeing the ones before it, right? I mean, what in the world could it result in except infertility?
No, exactly. I mean, we've gone through multiple potential causes, right? Just now, you and I understand, but most people, probably even most fertility specialists, don't yet understand because of the omerta about the vaccine that is in the OBGYN industry, you know, which Dr. Thorpe has described. I mean, Dr. Thorpe described a situation in which literally the OBGYN professional organizations got bought off with millions of dollars, but they have to return the money if they don't have their doctors stick to the script. So literally people are consulting their obstetricians and gynecologists and then fertility specialists in Ontario, no doubt with conditions like the ones you've just shared with us, Amy, like no sperm, low sperm, you know, dysregulated bleeding, decidual cast shedding, like inflamed fallopian tubes. And these specialists don't even know what it is or that it's a vaccine injury. You know, you and I understand our weird situation being exposed to these Pfizer documents, which are so focused on fertility. And because of our wonderful volunteers under your leadership, finding these mechanisms that ruin human fertility. But these poor people who are trying to conceive and can't conceive, they're not going to get honest or even probably well-informed responses from their fertility specialists or their doctors. Absolutely tragic. Let's go on to the next slide. Really creepy slide.
Yes, this is other disorders of female genital organs. It's OHIP code 629. I don't know specifically what falls under other disorders in this case, but to me, a lot of times when I see things like that, I think that it's, oh, we don't know exactly what to do with this, so we're going to put it in this code. So maybe that's the case. But on average per year, 2015 through 2019 was a little over 93,600. And then in 2021 to 2022, it jumped up to, on average per year, 113,621.
So that's per year. So that's
it's an average.
An average, but I understand, but an average of 10,000 more per year.
Yes. That's right.
So whatever other disorders of female genital organs is
20,000 more per year, because 103 to 113 would be
right. I'm sorry. Today, you're exactly right. So an extra 20,000 women in one Canadian province alone. I can't stress this enough. You know, now expand to all of Canada, now expand to all of North America, now expand to all of Western Europe. An extra 20,000 women in a year in one Canadian province alone are being coded other disorders of female genital organs. So something horrible. And I've seen pictures, like, you know, we've talked about inflammation. We've talked about skin conditions, you know, that are caused by the vaccine. I also don't know what kinds of conditions that codes for. It'll be interesting to hear from obstetricians and gynecologists when we raise this question, but something's causing disorders of the genitals in women, which is so tragic. And again, you know, teasing out the social cost of this. It's hard enough, right? It's hard enough to survive, you know, the number of women who've been molested in childhood, the number of women who've been raped, you know, the number of women who already have something they're ashamed of, right? I mean, I wrote, you know, my first book was about, images of women and images of perfection. So many women already feel like there's something wrong with their genitals, right? Or they've had horrific experiences, and there's shame and there's self-consciousness. Add to that actual physical disorders of the genitals and what that does to confidence, to self-esteem, to relationships, to intimacy, to marriage. We can't even begin. I mean, this category, this neutral slide represents a massive heartbreak, I'm sure, if we're deeper into it. Is there anything else you want to say about that before we go on to the next two slides, which are so tragic?
No, we could go ahead and move on.
Okay.
So
go ahead, please. You walk us through.
I was going to say, if you'd like to hold your phone up quickly. I did put the link into the chat. It looks like it may not be going out on X, but I think it went out elsewhere, the link to this post. So the next one is missed abortion, OHIP code 632. A missed abortion is also known as a missed miscarriage or spontaneous abortion. It's a medical term that's used worldwide. And it's a miscarriage in which the fetus did not form or is no longer developing, but the placenta and embryonic tissues are still in the mother's uterus. So before COVID in 2015 to 2019, on average per year, there were 13,323 distinct patients who were assigned this code. And then going and looking at 2021 and 2022, on average per year is 15,215 patients.
So that's a dramatic.
This is such a heartbreaking situation because, this is when the mother has to have what's left removed from her. And so she has the tragedy of this and then has to go through the tragedy of that process as well.
So I'm just going to read your note here. You may have just said this, but for people to really picture the horrors represented by this slide, an incomplete abortion is when some products are held back in the uterus after a miscarriage. In a complete abortion, products of conception have passed and the cervix is closed. So this is not, as I understand.
That's the next one.
I beg your
pardon. Just read.
I see.
So we can move to that one.
Oh, I see. Missed abortion. We're on missed abortion. I'm going to read that note then. Thank you. My apologies. A missed abortion, also known as a missed miscarriage or spontaneous abortion, is a miscarriage in which the fetus did, you read this, right? Not form or is no longer developing, but the placenta and embryonic tissues are still in the mother's uterus. So it's not one of those, no miscarriage is easy, right? No one wants a miscarriage. But there are, first trimester miscarriages where it's people that barely, don't know or barely know, right? And it's not as traumatic, I'm going to say, as what is described in this slide here, in which there's still placenta and embryonic tissues in the mother's uterus. And there has to be a DNC, presumably, right? And curettage to get that out, which is like an abortion, basically, to want a baby, presumably, in many of these situations. And I guess the other thing I would say is we know that maternal deaths have risen by 40%. And it is not without risk to have parts of your baby, that's dead, or parts of the placenta left in your body after a missed abortion, right? I mean, there's the risk of infection, risk of hemorrhage. Is that not correct?
Yes, that is right. I mean, you have to get it addressed quickly to keep yourself safe.
God. And that's a baby that, these are like, the language is weird, right? Because abortion means a chosen death of the baby or death of the fetus. These are not
socially. It means that.
Socially, it means that, but medically, right? I understand what you're saying. But I'm just stressing that most of these pregnancies, if not all of them, are pregnancies that would have gone on to term if the moms didn't have this habit.
These are not elective procedures in either one of the slides we're going to talk about. And also just for people who may not know, I didn't know before I took on this role, but I've learned this in the process. A spontaneous abortion or miscarriage is up through 19 weeks gestation. And then from 20 weeks on, it's a stillbirth, and they're considered quite different. But so think about that in this regard, that, I mean, this could be anywhere from early on in conception all the way up to pretty much halfway through your pregnancy. So there's never a good time. Like you said, it's never easy, but there's a lot of heartbreak as you get later and later in your pregnancy and have to go through a miscarriage.
So literally, you said up to 19 weeks. It's called this instead of stillbirth. Is that correct?
Right. A stillbirth is 20 weeks and on. Mm-hmm.
Okay, so you're getting up into the second trimester. So people have to picture a woman who's like 5.5 months pregnant, where the baby's moving, you can feel the baby, you can feel the baby's shoulder, the baby's arms, the baby's legs as they're kicking. That baby dies. Some of the baby is expelled. The rest of it in the placenta is still in the mom, and the mom has to go through the trauma of that beloved baby's body parts being removed from her body. That's what some of these cases surely are that. There's no way around it.
Yes, so the next slide is related to this. It's OHIP code 634, incomplete abortion and complete abortion. It's in one category in the database. And as you had started to read, an incomplete abortion is when some products are held back in the uterus after a miscarriage. In a complete abortion, all the products of conception have passed out of the uterus and the cervix is closed. And so if we look at the pre-COVID years, 2015 through 2019, on average, there were 18,960 patients who received this categorization of what was going on with them medically. And then in 2021 through 2022, it was an average of 22,465 patients a year.
Right. Tragic. I mean, I don't know what to say. This is a catastrophe. Is there anything that we have overlooked here that you want to call our attention to, or have we pretty much covered the main points that you found that you have brought to the world?
I think that we've covered the main points. I, of course, after seeing this, am quite interested to see 2023 data, and when it's available 2024, to see if things are getting worse or getting better. We certainly hope that they will be getting better, but there's still years worth of data that will need to be looked at to figure out what's really going on in the long term.
Right. And we can only infer that there's going to be that how can I put it, population levels will take a hit in Ontario if these trends continue. Like theoretically, you could have some families that are not presenting for diagnoses of these horrible conditions having more babies than usual in the next few years, and maybe the population will stabilize. But if that doesn't happen, inevitably you're going to be looking at a drop in live births in Ontario, right?
And which we've seen across the globe since the rollout of the vaccines, sadly. So I would expect that to be the case, yes.
Unbelievable. And just to, recap or back up what Amy just said, for those of you who have not been following, the work that we bring to you, a columnist whom we are proud to publish named Igor Chudov, a mathematician, has crunched the numbers for data sets of populations around the world, but especially in the West. And he's seeing a 13 to 20% drop in live births, a 13 to 20% drop in live births. We just saw that Zero Hedge covered the fact that the United States is seeing a drop in live births. Italy is seeing really a population collapse. And I don't know a Western country that is being spared this dramatic hit to the population. And
I think the only one I've heard of is Romania, which, you could say whether it's more Eastern or Western, but they did not have a big uptake of the vaccines, and it's reflected in their live birth rates. Taiwan has been hit really hard with a drop in birth rates as well, as far as going over and taking a look at the Asian countries.
It's shocking. I wonder how China's doing in terms of, they took a different injection than the ones many of us were mandated to take over here in the West. Well, this has been a heartbreaking interview, but probably I would say the most important interview I've done in my career. And, sadly, right, because we need to get the word out, and we need to save the babies to the extent that we can. We need to have the good doctors that are left, the good obstetricians, the good gynecologists and fertility specialists find treatments for these conditions. Maybe it won't be that difficult. Maybe if it's some weird change in the chemical makeup of body fluids, there's some easy way to alkalinize or make more acidic, or, create I don't know what, a bath of some kind to treat these kinds of interventions in what allows people to get pregnant, what allows men to have, semen with sperm in it that's healthy, what allows women to not have these horribly painful inflammatory conditions. We haven't even talked about how painful endometriosis and pelvic inflammatory disease is, agonizing pain. We need to tell the world about this, what you found, Amy, because only thus can we find our way to health for all these people with these heartbreaking conditions. I can't thank you enough for what you've done. I know you worked around the clock, exhaustively, to bring this to the world as quickly as you could. It's comprehensive. It's beautifully done, and I'm honored to know you, and I'm honored that you're doing this work as part of the Daily Clout community and Daily Clout leadership. I guess I don't see questions and comments. So, no, there are many. There are 51 comments. Look how high tech I am. So Allison Amber Luna says the population increase has already taken a hit in Western countries as opposed to Asia and Africa. And she adds that China is also doing badly with new birth rates. Trevor Coker said, agree, share this space. And he also said, utterly heartbreaking. And so looks like people are trying to support us. A6 says boycott mainstream media advertisers, or you could support independent media and our advertisers. We are the alternative, and we're fighting very hard to bring you the truth, bring you this important research and other important independent news and breaking stories, uncensored opinion. And we need your support over at Daily Clout. So if you think that what Amy Kelly did is important to you and your families, please support us. We cannot do this without your help. We rely on donations and memberships. So, help us. Let's make this an army. Let's see. Allison Amber Luna also says, now that AstraZeneca have testified that they knew of side effects, what do you think? I mean, I guess I'm not going to speak for Amy, but from what we've seen, they all knew everything, right? What would you say to that?
Yeah, they just admitted it. They've known about it for a long time, definitely as long as this lawsuit has been going on, in my opinion. There was very early evidence of TTS once the vaccines rolled out, and that's what they're specifically admitting to in this lawsuit.
That's right. Thrombotic thrombocytopenia. You informed me about it, and Dr. Chris Flowers did as well in 2022. And if we hadn't been so silenced and censored by the mainstream media, everybody would have known in 2022 that thrombotic thrombocytopenia and other side effects were abundant in the Pfizer documents, and a lot of lives would have been saved. You've saved a lot of lives, though, Amy, millions.
Oh, thank you.
Coleman, thank you. Patrick Coleman says, appreciate all you do, Dr. Wolf and Amy Kelly. This has been the Gates Johns Hopkins Event 201 eugenics program. It's hard to argue with that, looking at these data. I mean, this is a eugenics program because, you know why? Whatever other evidence you may have, all these hospitals that coded this data knew that this was happening. Right, Amy?
Exactly. They were some of the earliest people to see what was going on. And when you talk to medical professionals, that's what you'll hear. And then the other set of earliest people to know were the insurance companies that saw the
Exactly.
data rolling in.
Exactly. I mean, we've really got to wrap our brains around that. We're not seeing brand new data that, they saw and said, okay, let's stop this immediately. We're seeing data now that's a year and a half old, and 2.5 years old. They started to see these rises in 2021. It's now 2024, and they're still pushing this injection. So every single hand, I mean, it's like the FOIA emails we have, Amy, through our lawyers that show the White House knew that thrombotic thrombocytopenia and myocarditis were side effects for minors in April of 2021. And instead of stopping everything, they just kept going. So every person who saw these data sets, which include thousands of people in Ontario, including the government of Ontario, is complicit in mass sterilization, if not ruining so many lives. Janice Jones says, because my daughter took the jab, my daughter bled for over a year until her doctor put her on birth control. Doctors say now that she will never become a mother. And then there's a furious emoji, and I don't blame you. How tragic. I'm so sorry. Alison Amberluna says that her immune system is not good to start with, but now she has swollen tonsils all the time. It's very sad. And again, not surprising, the kind of infection or autoimmune or immune problem that, we see that's very common. And Janice James says, never any children from her or grandchildren from me. And then there's a emoji. This is so sad. Free for Health says, thank you both. Prayer emoji. I'm a nurse in Alberta. I lost my job due to making a stand. Massive consequences. I'm so sorry that happened to you, Free for Health. I'm sure you saved many, many lives too, but I mean, your life, I can't imagine what you went through or are still going through in Canada. It's such a draconian system, and all I can say is you're on the right side of history. You didn't participate in this bloodbath.
I see someone asking about shedding, who started bleeding after 2 years of menopause. And I would say that that's definitely a possibility. Shedding is real, despite what all the fact checkers say. And we've written about it if you search for shedding on Daily Clout. Also, Dr. Pierre Corey recently did a Substack post on it that was very comprehensive. And I recommend checking that out as well. But you can have health conditions that occur from being in close vicinity on a regular basis with vaccinated people, even if you aren't vaccinated.
Right. Wow. Very good point. I guess I'll just wrap this up in a minute, but I want to note that Osiris Oft Ones has just reading the initial Pfizer documents. I hope you're reading the book that Amy Kelly put together, an amazing historic book. I expected this accumulation in the testes and ovaries in only 48 hours. They monitored what could go wrong. I mean, exactly, right? Going back to Amy's point about they knew from the beginning. They saw that these materials, the lipid nanoparticles, which are inflammatory, accumulate in the ovaries and the testes. And now we're seeing the results of that.
And that's when they were telling everyone they were still saying, oh, it stays in your arm. But in the actual Pfizer clinical trial, they were showing that it went everywhere.
That's right. Tragic. Well, I hope that this is the darkness before the dawn, Amy Kelly. I hope that many people are saying so grateful for these conversations. Thank you. I know you have so much support and so many prayers of support, and all we can do is thank you and cheer you on and tell you, please don't stop. This is so important for humanity. You've done a masterful job bringing this to the world and also explaining it verbally. I'm very grateful for you and everyone. You can find Amy Kelly's essay. Amy, do you want to direct people to your essay and your book and the upcoming book?
Yes. So If you go to dailyclout.io, right in the latest news section, you'll see this as the first post. That's the easiest way to find it. For the outlets that would accept it, I put the link into the chat, but not all of the outlets populated that out. The original book is available as a PDF in dailyclout.io /shop. And then the newest book is called The Pfizer Papers. You can pre-order it. The best place to do that is on Amazon. If you would like to look at other options, you can go to skyhorsepublishing.com and search for The Pfizer Papers, and it will show you other options of places that you can pre-order it. And we really appreciate you guys supporting us by doing that.
Yeah, again, thank you all for your support. I'm going to sign off, but we'll be back when Amy has more to share. Thank you all, and thank you, Amy Kelly. Amazing, amazing presentation.
Thank you. Bye-bye.